So actually to give you a case study of where we did involvement. Can I have your permission to kind of change our presentation around a bit? I've got one nod from a lady down here, I've got two nods. What I'd like to start with is to ask you, in the room, as people, what are you involved in? So in your lives, what things are you involved in? Anybody?
A choir.
A choir, thank you. Your name is?
Linda.
Linda. Linda's involved in a choir. Anybody else?
Women's Institute.
The Women's Institute. So the lady in a lovely blue jacket, what's your name?
Ruth.
Ruth's involved in the WI, Women's Institute. Anybody else? Gentlemen, are any of you involved in things?
Community radio station, credit union, refugee charity.
Wow. So these elements of things that we're naturally involved in. Have we all got something in our mind of where we're involved? For me, it was just generally being at home, being part of a family. How does it feel to you to be involved in something? So that's really what we're talking about today. To genuinely be involved in something. Any words of thought? How do you feel? Feels good. Where did that come from? Thank you. Feels good. To truly be involved, how else does it feel?
You own the issue.
Where was that? Say again.
You own the issue, you're involved, it's good to be involved.
So it feels good and you own the issue. So when we're talking about finances, if somebody really owned their issue, were truly involved, what quality would that bring? And I think we've seen that with Kate, really owning that issue. So our presentation, we're delighted to actually be here. We are a presentation team, but we're representing a much bigger team. We've got the pleasure of having Sam, who's actually been part of the involvement team itself. We've got Janice, who's in the middle of the chairs there, who I think many of you have met on our stand. And really to encourage you to come and see more of what we've been doing. And myself, Kerry, I was the operational lead for the project. So we're actually here, NHFT have paid for us to come up on the train from Northamptonshire, and we're representing particularly the work that we've done with the Community Wellbeing Service project. Community Wellbeing Services, is that something that in the audience we're familiar with? Health and Wellbeing Board wanted to put together health and social care. So it's a brand new tender. And in terms of the introduction, to give you the bigger picture, is within our trust, this is a new way of working forwards. We're looking at not just the health care, but the social care as well, and integrating partners with that. As a group, as our conference today, who are the most important people that we need to consider in that process? So in terms of our patients, our service users, that was the number one. And that's where when we had the opportunity from the Health and Wellbeing Board, this was released in June of this year, so it's very, very recent. It was a tender application that ran for 3 months, and we were delighted to have the opportunity again to present to the actual tender team in September. We are waiting, we are currently in the standstill. I'd love to be able to tell you the outcome, but we're currently waiting for the outcome of that tender. And the involvement team. At the very first meeting, I felt relieved. I'm a consultant working for the Trust, and I felt relieved that at the very first meeting they said, we need transparency. We need to actually have people that will be potential customers in this service involved now. And that was from the very day one. And that's where the team grew. And it was just brilliant to see it develop organically, and just to really highlight the experience and also the support provided by individuals like Janice, who actually give that background as well. Although Janice isn't here, in terms of the level of support, it couldn't happen, an involvement team couldn't happen without that being in place. The picture in the middle, some people from the involvement team did not want to be on the picture. So I'm going to put them back up bigger, because again, they were the drivers for the whole project. You don't have an involvement team if you don't have people involved. It needs to actually have that doing action, and you can see there a representation of those individuals. And you will hear from somebody who wasn't actually in that picture a quote later in the presentation. That's where I switched the presentation around. Hopefully you can hold on to that thought. If I was truly involved in something, whether it's a service or something for you, what is that experience like? Being given the opportunity to involve people, this is where I was given a blank page. And the deputy director asked me to really do this properly, and he said, who needs to be involved? So we looked at, again, what the tender requirements were. So it wasn't just who was around, it was who do we need to achieve this tender. And in terms of you can see down the top left, the red box, we involved the carers, the patients and the staff. For me, that was no rocket science, that was absolutely what needed to be involved. But underneath that, also potential partners. So we weren't just thinking about the customers, but also who else would they be dealing with, and making sure that was brought together properly. You can see on the bottom, on the left-hand side, the staff teams. Staff members in the room, would you like to be involved if the service was being developed? Yes, there's definite nods in the room. And in a sense of really understanding their expertise, not just of what's going very well for them in their staff teams, but what would they do differently? And it's given, again, that open, transparent conversation about how would they develop the actual service being provided. In terms of the service, you can see there, so smoking cessation, wellbeing navigators, learn to be, trips and falls, and weight management. Why do you think those services were particularly chosen? Any thoughts? Why those services?
There are things that cost the NHS the most.
They cost the NHS, yes, definitely. And there's another comment. Key targets, absolutely. So it was very specific and very focused. They were the services that were engaged in the project because that was the outcome we're aiming to achieve. And then the important group. On the right-hand side, the green box, you can see there a list of all the experts that we needed. That was the list. The tender was very well written, the specification, and it's very clear what the outcomes were going to be, the KPIs, the things that were going to get us the award. So you can see the list in terms of what the expertise was needed, and that was then where the challenge was to find those individuals. It was actually easier than we thought, and what we used was the staff teams. The box on the orange box, that staff team was mobilised to say, who do you know that has had this lived experience? So actually organically they did the hard work for us as an involvement team, and they then energised the team, and we had 9 members that were part of actually a service user group, and they represented all of those areas. So that's the bigger picture. Much, much more importantly, what was the experience like? And that's where we've got the expert with us here, who represented the young adults and also equality of access. To introduce you to Sam.
Hi everyone, my name is Sam. I'm a student at the University of Southampton. I'm 21 years old and I'm currently studying sports studies and health studies as a joint honours degree. And I'm in my final year doing my dissertation. A bit about how I got involved. During the time, I got a phone call from Carrie, and she invited me over to be part of the involvement team. In my first year and second year, she was actually my mentor. She helped me out with essays, writing, and things like that. And I was very honored and privileged to be part of this team because I felt that my voice as a young person needs to be heard as well. During the time as well, I was working for Thesis, which is a company in Milton Keynes, and I was working on behalf of the Tesco Bank, and I was doing a lot of hours, so I couldn't actually be with the involvement team at the beginning. But the involvement team and Kerry herself did the extra effort to update me with, through emails, and I was checking them regularly. And we also managed to use social media to interact. We used Skype, and she was just sharing some of the things they talked about in within the group and the meetings and things. And I had the opportunity also to share my experience using the health services, and I was also able to contribute and say my part of the story of how my experience was, given the fact that I was born in Germany. I moved to England, and I see things from a different perspective as well. The first time I got to see the involvement team was at Brixworth Country Park. It's a lovely atmosphere, wonderful landscape. We were all there as a team. I got to see Janice and Kerry herself and the actual team, and we were talking about some of the issues that are going on in the health sector, and and some of the issues that needs to be addressed. And being a young person, I was telling Kerry as well that, and the involvement team, that I felt a bit vulnerable, but it's a good experience because you learn as you listen from other people as well. I was updated after the meetings as well because we're all waiting to hear the final results, and now I'm here today to be part and present to you guys my experience. The things that I really cared about, which actually motivated me to be part of the team, was my friends, my family, the people outside, coming from maybe from a different European country to the UK, like myself, using the health services. We have a different expectation, and we want the best, obviously, coming from a different country. But my experience as a young person, when I went to my first local GP in the UK, wasn't quite as I would have expected. I brought my issue across. I told them what I was going through, but I felt that the listening part of my the approach in which they tackled my issue wasn't right. So as a young person, you feel a bit, okay, is this for me? Am I going to go to the GP if I've got a problem again? And yeah, that really put me down. And it's not just me. Some of my friends said the same thing that moved into this country, saying that it was more of a checklist, diagnosis, what are you going through, and then they tell you go and find this medicine and you'll be fine, kind of thing. And if you're gonna take off from work and see the GP and that's how you feel, I feel that the social needs of the person is not really met. It's rather do this, take this, and then you'll be fine. And also as a young person, being involved in the involvement team, I felt that, yeah, of course, being a young person, you see things different, and you want to represent the young people as well, and that's why. Overall, my experience with the involvement team was very good. It was excellent. The people were awesome. Listening to other people, like I said before, it was very key to me, because it helped me to understand some of the issues and the challenges that I'm going through. Sharing my ideas as well was key for me as well, because I felt that my views were really mattered as well, and it was an opportunity for me to also express myself. I gained knowledge and the experience. I'm a health student, so listening to people and actually being involved and not just reading a book from the literature helped me to really understand, actually, yeah, this is very interesting. And I'm a people person. I run youth groups as well, privately. My dad is a pastor as well, and I'm a pastor's kid. And so listening to people is some of the key skills I need to have. And yeah, felt vulnerable at times, being a young person, even standing here in front of you guys, it's like, oh, okay, yeah. But I was sharing to Karen as well some of the things that we could improve as part, being part of the involvement team. So the fact that we could prepare and beforehand, before we come there and share our views, and then come as a group, sit in a circle, and then talk about some of the things that we thought about before we came in, and then share it out, say it, and then come with a collective idea which will help us to come up with better outcomes as well. And finally, we all want to see what will happen next. And thank you.
And it did amaze me through the involvement process just how generous everybody in the involvement team had been. And I think that was the example of doing more. And I think listening to Sam there around the area of how it could have also been better, I think is something not to be afraid of. Because when we were learning organically, things didn't always go right. But as a team, we got through it, and that's because the team trusted each other. So it wasn't just a cake and tea party, as somebody once said to me. Involvement's just cake and tea, isn't it? You just sit and talk. No. Being ex-military, there is outcome. So within that, the project was driven to achieve the outcomes. And that was to make sure that we did have, you can see at the bottom there of the circle on the right, the outcome was the tender submission. And reading through the 300-page document, it was very robust. Also having the opportunity, and that was the outcome of the success of the tender application, was also the presentation. And on the morning of the presentation, one of the involvement team actually came along to wish us good luck. He managed to find out where the presentation was and came and said good luck, because it mattered that much. So the outcome list that you can see there on the right-hand side, the development of the service delivery model is the model that was produced in the tender. So it wasn't, thank you very much for your ideas, really useful, now we'll go away and create that delivery model. It was actually, what do you really think will work? What will be this new service? And it's a new innovative service that we're looking to create. How can it really work on the ground? And that was presented. Also, I'm smiling because the holistic assessment tool was probably the area that caused me the most lack of sleep. Imagine 9 people all saying how it needs to be done and all caring about how it needs to be done. What we did manage to come up with is a combined holistic assessment tool, and hopefully it meets the needs of everybody. As we maybe have the opportunity to go forward, is then also thinking how do we keep developing that. In terms of the detail of the staff, almost to the point of writing job descriptions. Who are the people technically, but also behaviourally, that will be delivering this service? And making sure that those individuals are the ones that you'd want to walk through the door to. Sam was very clear when we talked why Sam wanted to be involved, was around, I'd actually like somebody to listen to me as a person. I think Kate was saying, I'm a person, treat me like that. No matter what my condition is, I am still a person. And that was very clear that that was potentially missed. Also the skills. The involvement team are not just there in terms of somebody that just wants to be involved in the tender, have got past experience as well. We had a very experienced proofreader with a 300-page document. You can't really see the words very much more once you've seen it a few times. So to hand that over to somebody else within the team was brilliant. And within a day, Dennis, it came back. Yeah. A really, really effective way to use a team. And also for them to keep practicing their own skills as well. And that was a lady called Dora. Also within there was the input in terms of the wellbeing presentation. The 2 members of the presentation team that are not here today are Sue and again Dora. And as soon as we found out, it was only a week and a half ago, Alexis, we said yes. The team has been involved very much in the background, even putting together the presentation board, and that was done by a lady called Sue. Again, so generous in terms of what they gave into the project. The bit that really, I think, kept the whole team afloat, not the involvement team, the actual core team doing the project, was the enthusiasm that kept coming back in the door. And that was every time we had an involvement meeting, whether it was by Skype, whether it was with an individual one-to-one, we just got that injection again of actually this does matter. And it is something that needs to happen, and this is the right way to do it. It felt like the right thing to do. The cloud that's been put on there on the left, this was something, again, I wanted to share, particularly with our conference today. It was put together by a lady from the admin team. And this is a lady who's normally very, very quiet and doesn't necessarily contribute much in a meeting. But afterwards, and when we put together a document, which is actually the case study for the Community Wellbeing Services Tender involvement team, this is what the lady Sharon created. And again, it's in the background of everything in terms of the ideas and the knowledge, and again, the commitment to actually being involved that was so special with this project. If you would like a copy of the booklet, what we are doing today, Janice, Sam and myself, just taking names and contact details. So it'll be an e-booklet because our trust is trying to work very hard with the paperless. Anybody else? Yes. So we're going to disseminate that through e-copies, and you'll be very welcome to have that and share that as widely as you can. So if we're here to celebrate this case study, and it really is a celebration, no matter what the outcome from the tender, we're celebrating the involvement so far. Why don't we do more of it? Why do we need a conference on involvement? It makes sense to do it. When we started to share what we'd learnt from the involvement team, it was very much then looking at the different perspectives. the left, you can see our Chief Executive, Angela Hillary's perspective from Northamptonshire Healthcare Foundation Trust. It's our core business, she says. It's the expert's perspective that we need to hear, she says. And also, what Angela particularly values is the personal approach. And that's something new that's come into the Trust. Make it individual. The service users, when we sat with Sue and Dora, they said, these are all the barriers, Kerry. Let's put the good ones in there as well, because it mattered so much to them. But potentially it can go wrong in terms of lack or poor communication. I think we've heard that today already. But also different agendas, making sure people are in that room because they care about that project. And it was actually Dora who said, I really feel like I know that I'm counted. I feel valued. That was a perspective on involvement from the service user. The staff, in terms of people, because I think we say staff and we forget even staff are people, their involvement or perspective on involvement was fear. The reason they didn't do it was they were frightened of consequences. If I work with a vulnerable adult and it gets worse because they're involved, where does that leave me? If somebody that comes along and gets involved in a project and becomes unwell, what then happens? And there was fear of consequence of this involvement. And also time. Is anybody pressured for time in the room? Yeah? I've definitely got a big hand up there. Well doing, yeah. In terms of time, it's not just the recruitment, it's also the engagement. And it does take time to keep this continuous communication going. And the expectations. One of the areas, and I think it's the risk for involvement, is if you have true involvement, you can get over in the sense of they want more and more and more. So they want to become more involved and how to manage that. But it is absolutely invaluable. And this, for me, really sums it up. This is Jack, who has extreme schizophrenia. Jack was unable to come to any of the early meetings, and because he could not be in a group environment. So I met him in the local cafe. It was very informal. We just sat and listened. Same questions, different environment for the right person. And this is what Jack said. Absolutely wonderful to finish that story really in the sense of Jack's own journey developed. So by being involved, Jack then came to the celebration event and he walked in a room of 30 people by being involved. Top 3 tips to take away from my perspective. In terms of actually running an involvement team, meet the needs of the individuals, and that's engage with them properly. Really, really listen to what they need first. From there, listen and understand the experts. Just to check, who are the experts? Service users. The people that will receive the service. They are our experts. And then the bit that we'll continue to do, this is probably the bit that if we were to do anything different, I would want to do more of this, communicate the outcomes. As soon as we know the outcome from this tender, it will be everywhere. But it's making sure that they really feel that by putting into the project, that they also receive the outcomes and they benefit from those. Last words, back to Sam.
Just one thing that I want us to take home, and this is it. To achieve quality involvement, you need to truly involve the community, and I feel that that's what we did. Thank you very much.